Today, we're diving into cystic fibrosis. Now, this is a really complex genetic condition, no doubt. But honestly, it's also this incredible story of scientific progress and how understanding what's going on inside the body has completely changed how people live with it.
Okay, so let's jump right in. At its very core, cystic fibrosis, or CF for short, is something you're born with. It's passed down through genes, and it specifically targets what are called the exocrine glands. The easiest way to think of these glands is as the body's moisture makers. They produce stuff like sweat, mucus, digestive juices, you get the idea. In CF, this whole system kind of goes haywire, and that creates two main problem areas, the lungs and the digestive system.
So, to really get what's going on with CF, we have to zoom way in. It all boils down to a single, tiny flaw in our genetic code that ends up creating this massive ripple effect all through the body.
And this is that ripple effect in action. See, that faulty gene makes a broken protein. This protein is supposed to act like a little gate on our cells, letting salt and water flow in and out. But when that gate is broken, water can't get out to thin the body's mucus. And what's the result? Well, instead of being thin and slippery like it should be, the mucus becomes incredibly thick and sticky, almost like glue. And believe it or not, this one single change is the root cause of all the problems we're about to talk about. Now, what's so wild is how this one problem, that sticky mucus, causes so much chaos in a few key places. In the lungs, it's basically like flypaper for germs and bacteria, which leads to constant infections. Then you have the pancreas. Here, the mucus acts like a dam, blocking all the important enzymes your body needs to break down food. And that blockage leads directly to problems in the GI tract, where the body just can't absorb the nutrients it needs to survive.
Okay, so we know what's happening on the inside, but what does that actually look like from the outside? What are the telltale signs that make a doctor start to think, this could be cystic fibrosis?
Well, the most classic signs are all about the lungs. And it makes perfect sense, right? That thick mucus is clogging up all the airways. This leads to a persistent nagging cough that just doesn't go away. And worse, it traps bacteria, basically turning the lungs into a breeding ground for infections like bronchitis and pneumonia. So when a doctor listens with a stethoscope and hears wheezes or crackles, that's the actual sound of air literally fighting to get through those blocked-up passages.
But the trouble doesn't stop with the lungs. Remember that mucus dam in the pancreas? Well, it means the body can't break down fats properly. This leads to greasy, foul-smelling stools, which is a classic sign of malabsorption. For a baby or a young child, this is a huge deal. If you can't absorb nutrients, you can't grow, which is why failure to thrive is such a major red flag. You might even see physical changes, like digital clubbing, where the fingertips get wider and rounder over time because the body just isn't getting enough oxygen.
All right, so the signs are there. The puzzle pieces are on the table. How do doctors put them all together to say with 100% certainty this is cystic fibrosis? Well, the process is incredibly methodical, and it's designed to leave absolutely no room for doubt.
It's not guesswork. There's a really clear pathway they follow. You can think of it in 3 steps. First, they gather clues from the patient's history, that chronic cough, the frequent infections, the issues with growth. Next up is the physical exam, where they listen for those telltale sounds in the lungs. But the final, indisputable answer? That comes from a set of very specific tests.
And the absolute gold standard here is the sweat test. I know, it sounds a little strange, but because of that faulty gene, the sweat of someone with CF is extremely salty. And there's a magic number they're looking for, 60 millimoles per liter. If the chloride level in the sweat is above that number, it's a clear confirmation of CF. It's a simple, totally painless test that gives a really powerful, definitive answer.
And they don't stop there. Doctors use imaging and other tests to actually see the impact of the disease. So in a chest x-ray, for example, they might see something called hyperinflation. That basically means the lungs are overfilled with air because the old air gets trapped by mucus and can't get out. Then there's spirometry, which is a breathing test. They measure how much air you can force out in 1 second. If that number's low, it confirms there's an obstruction. And these tests aren't just for diagnosis. They become really important tools for tracking the disease over a person's lifetime.
So the diagnosis is confirmed, and that leads to maybe the most important question of all, right? The one that every patient and family asks. What now? What comes next? A diagnosis isn't an endpoint. It's the starting line for a proactive, lifelong plan. And this is where things have really changed over the years. We're moving into how life with CF is managed today. And it is all about a comprehensive, proactive strategy designed to fight the disease head-on and help people maintain the best possible quality of life.
So let's say someone's having a really tough time breathing. Maybe a bad infection kicks in. There's a specific emergency plan, and it happens in a really smart, logical order. Step 1. You have to open up the airways, usually with an inhaled medicine like albuterol. Step 2. Attack that thick, sticky mucus and thin it out. Step 3. Get it out. This involves airway clearance, using things like special coughing techniques or even a vibrating vest to physically shake the mucus loose. And finally, step 4, if there's an infection, you fight it directly with an inhaled antibiotic that goes right to the source of the problem.
But it's not just about emergencies. The day-to-day management is absolutely crucial, and it's a serious commitment. It's an active partnership with the healthcare team. We're talking about protecting the lungs with things like annual flu shots, fueling the body with a special high-calorie, high-fat diet, and taking pancreatic enzymes with every single meal and snack to actually absorb the food. Exercise literally becomes medicine, helping to keep the airways clear. And regular clinic visits every few months are completely non-negotiable to stay one step ahead of the disease.
And this really brings it all home. Look, there isn't a cure for cystic fibrosis yet, but the story here is one of incredible progress. A dedicated, daily, comprehensive management plan has completely transformed what it means to live with CF. It's about empowering people, slowing the disease's progression, and giving them the tools to lead fuller, longer, and healthier lives. The real key isn't just about treatment on the sick days. It's about the consistent, relentless strategy on all the good days in between.